Antimicrobial therapy of community-acquired infections is usually empirical, either because of the difficulty in establishing the identity of the bacterial pathogen, or because of the delay in determining the pathogen's antimicrobial susceptibility. There are many factors that influence the selection of an antibiotic. To select the most appropriate antimicrobial agent, the following factors should be taken into account: the spectrum of antibacterial activity, and the safety and tolerance profile. With over 30 years of experience, Augumentin is consumed by millions of patients every year around the world. Every second, 68 units of Augumentin are sold worldwide. Formulations in over 150 countries. Amoxicillin is an active component of Augumentin, a semi-synthetic antibiotic from the group of aminopenicillins. Amoxicillin is readily hydrolyzed by beta-lactamase, an enzyme produced by bacteria resistant to beta-lactam antibiotics. Augumentin also contains the beta-lactamase inhibitor, clavulanic acid, which protects amoxicillin from degradation and therefore extends its antibacterial spectrum to pathogens normally resistant to penicillins and cephalosporins. Augumentin was originally developed in response to the need for an oral broad-spectrum antibiotic that covered beta-lactamase-producing pathogens. Oral formulations of Augumentin have been available worldwide since 1981 and intravenous formulations since 1984. Over the years, the ratio of amoxicillin to clavulanic acid has been varied to reflect prescribing needs, to improve dosing convenience, and as a response to recommendations for the treatment of more severe infections or those caused by resistant organisms. Key milestones in the discovery of Augumentin. In the journey of antibiotic discovery, GSK has been engaged in the development of various semi-synthetic penicillins. Beecham Research Laboratories Limited, a predecessor of SmithKline Beecham plc, became famous when Beecham scientists there discovered the penicillin nuclease, 6-aminopenicillanic acid. This allowed the synthesis of a number of new semi-synthetic penicillins. In the period 1950s to 1960s, Beecham Research Laboratories Limited developed penicillin derivatives, first phenethicillin, followed shortly by methicillin. In 1961, ampicillin, more commonly known as Pemberton, hit the market. In 1972, Beecham launched amoxicillin, commonly known as Amoxil, which went on to become one of the most widely prescribed antibiotics. Within the same year, Beecham Research Laboratories Limited developed clavulanic acid from its bacterial derivative. Augumentin, the first oral coamoxiclav preparation, was launched in 1981 by Beecham to treat a wide range of bacterial infections in children and adults. Various formulations of Augumentin with an increasing ratio of amoxicillin to clavulanic acid followed during the 1990s and from 2001 onwards. GSK initiated a decade-long Alexander project in 1992, followed by SOAR, which is the study of antimicrobial resistance, from 2002 onwards, to provide surveillance data on resistance patterns around the globe. Today, 3 decades after its launch, the rationale for the use of Augumentin remains unchanged. Augumentin demonstrates a broad spectrum of activity against a wide range of pathogens and infections. As shown in the table, Augumentin covers major gram-positive, gram-negative, and anaerobic pathogens when compared to other antimicrobial agents. Pathogens commonly susceptible to Augumentin include Streptococcus pyogenes, penicillin-susceptible Streptococcus pneumonia, methicillin-susceptible Staphylococcus aureus, Enterococcus faecalis, Haemophilus influenza, and Moraxilla catarrhalis. Augumentin is consistently recommended by leading guidelines for the treatment of a variety of bacterial infections in adults and pediatric patients. The problem of increasing resistance among pathogens commonly isolated from respiratory tract infections, namely strep pneumonia, Haemophilus influenza, and Moraxilla catarrhalis, is of growing concern to healthcare professionals. The development and spread of antimicrobial resistance amongst respiratory tract pathogens has compromised the efficacy of some commonly used antimicrobials. The choice of therapy should take into consideration the local and international resistance profiles so that development of resistance may be slowed. This chart illustrates the susceptibility pattern of the major respiratory tract pathogens, Haemophilus influenza, Moraxilla catarrhalis, strep pneumonia, to Augmentin. The susceptibility of Augmentin remains favourable throughout 3 decades of use, helping it to continue its legacy in curing respiratory tract infections. Recent data indicate that clinical success rates for Augmentin in respiratory tract infections are maintained at approximately 90%. In addition to high efficacy, Augmentin has a well-known established safety and tolerance profile based on its use in over 800 million patient courses worldwide. It is well tolerated, and the most common adverse effects are diarrhea, nausea, vomiting, and mucocutaneous candidiasis. Nausea is more often associated with higher oral doses. If gastrointestinal reactions are evident, they may be reduced by taking Augmentin at the start of a meal. Careful inquiry should be made concerning previous hypersensitivity reactions to penicillins, cephalosporins, or other beta-lactam agents before initiating therapy with Augmentin. However, many patients are unnecessarily labelled as being allergic, and because of the fear that they may develop anaphylaxis, are denied access to indicated antibiotic therapy. The evaluation of patients with allergies to beta-lactam antibiotics by allergists or immunologists can lead to improved utilisation of antibiotics and help decrease the spread of multiple drug-resistant bacteria. Locally, Augmentin is available in the following formulations. For adults and children equal to and above 40 kilograms, Augmentin 375 mg film-coated tablets to be taken as 1 tablet 3 times a day. Augmentin 625 mg film-coated tablets to be taken as 1 tablet 3 times a day. Augmentin 1 gram film-coated tablets to be taken as 1 tablet twice daily or 1 tablet 3 times a day, particularly for infections such as otitis media, sinusitis, lower respiratory tract infections, and urinary tract infections. For adults and adolescents equal to and above 16 years of age, high-dose Augmentin sustained-release tablets are also available and should be taken as 2 tablets twice daily for a duration of 7 to 10 days. Infants and younger children should preferably be treated with Augmentin oral suspension. The dose of Augmentin that is selected to treat an individual infection should take into account the expected pathogens and their likely susceptibility to antibacterial agents, the severity and the site of infection, and the age and weight of the patient. Dosage cards are available to assist in the selection of the right dose for your pediatric patient. Augmentin is a well-established and widely used antibacterial product. For over 30 years, Augmentin has proven its clinical and bacterial efficacy in the treatment of various community-acquired bacterial infections. Conventional Augmentin 625 mg and 1 gram tablets, together with Augmentin duo suspension formulations, are indicated for the treatment of the following infections in adults and children. Acute bacterial sinusitis, adequately diagnosed. Acute otitis media. Acute exacerbations of chronic bronchitis, adequately diagnosed. Community-acquired pneumonia. Cystitis. Pyelonephritis. Skin and soft tissue infections, in particular cellulitis, animal bites, severe dental abscesses with spreading cellulitis. Bone and joint infections, in particular osteomyelitis. The high-dose presentations of Augmentin SR tablets and Augmentin ES suspension are indicated for the treatment of infections caused or thought likely to be caused by penicillin-resistant Streptococcus pneumonia. Augmentin ES suspension is indicated for the treatment of acute otitis media and community-acquired pneumonia in children aged at least 3 months and less than 40 kilograms body weight. Augmentin SR is indicated for the treatment of community-acquired pneumonia in adults and adolescents aged at least 16 years. The characteristics that have contributed to the longevity of Augmentin include the potent broad-spectrum activity, maintained bacterial susceptibility, favourable pharmacokinetic, pharmacodynamic profile, and good tissue penetration. The innovative combination of amoxicillin and clavulanate in Augmentin continues to be a valuable clinical tool for the treatment of respiratory tract infections both now and in the future. Could you estimate how many units of Augmentin are sold every second worldwide? A. 10, B. 35, C. 68.